Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café. I have with me today Dr. Debbie Smrz, and she's a certified naturopathic doctor, a hypnotherapist, a rugby coach, and fitness instructor. She has studied meditation and Buddhism philosophy at the Swan, I'm probably not saying this right, but Swan Monk Monastery in Thailand and German biological medicine in Germany, and has done many different types of mind-body retreats. So I'm going to stop with the bio here and welcome you, first of all, to participate in just a discussion about, what it's like to be in practice, what have you noticed, what's going on, and starting with what actually got you into wanting to become a naturopathic doctor.
Well, first off, thank you so much for having me. Very much looking forward to our chat. I always wanted to know everything that a doctor knew as far as healing, but I didn't want to be forced to practice in the paradigm that medical doctors, especially in Ontario, were forced to practice very short appointments, one symptom. And so when I learned about naturopathic medicine and it was really about treating the whole person, it very much woke me up to the ability. I also find, doctors today spend a lot of time triaging. They don't spend as much time actually treating. And so I love it that in my practice, I get people to still bring in their first morning urine and I do assessments right there. I do a lot of different biohacking tools on the testing versus just sending patients away. And I always wanted to focus on the brain. I thought I would be a psychiatrist. And so with naturopathic medicine, you really get to do it all.
True. So, but what was there something in your life that got you interested in the field of healing in the first place?
So I didn't have anything happen to me particularly. I've always been quite intuitive and I've always been able to see what people need and to support them in certain ways. But I'm not one of the naturopaths that always had digestive issues and that's what brought them to see a naturopath. I actually discovered naturopathy a little bit later in life. I initially actually wanted to be a motivational speaker. And so I heard these motivational speaking and I'm like, this is amazing, but what platform am I going to use? What am I going to speak on? And then I started learning more and more about natural healing and herbs and just the benefits that we can do for people without drugs. And I thought, this is the platform that I want to go on to.
Well, I think, the timing is amazing because first of all, I'm sure that you've noticed changes in your practice, which we can talk about in the last 2 years during this whole episode of the pandemic. But many people are getting discouraged now with so-called modern or conventional medicine, where some of the solutions that they're bringing to the table, like, resveratrol and all that are more deadly than, as it turns out, the actual thing. I'm not using certain words so that we don't get banned, but are quite deadly, right? And then other drugs that are not nearly as bad and have been time tested are banned. We're in a very strange time period, and I think people are going, what's going on? Like I've seen an increase, though I'm not practicing anymore, a great demand for naturopathic medicine. At least, I've been referring left, right, and center in BC. So
yeah, and I think there's a couple of different reasons for this. One is the medical system has changed in itself.
Yes.
the allopathic medical system. People can't get patients in to see their doctors because everything was shut down for so long. Everything is so backlogged. People are feeling discouraged. And I think that's the first issue that's going on. And then again, they spend so much time triaging. And we don't understand it. I think as patients for medical doctors, we don't understand why we can't get in to see them. Why is my medical doctor not seeing me now? Why is everything online? I understand it changed. Why hasn't it changed back? And then people are feeling isolated because they can't get in to see them. They're not getting to see other people. Yeah.
Mm-hmm. Yeah, no, I think there is a change within the system. At least I know also with nurses that I've talked to a lot, they feel like they're just, administrators at this point. And there isn't the sort of quality of time, with the patients, even in the hospitals, so there's a real, and then of course, when they made, decisions like, despite that, nurses and doctors were there when in 2020, while we were having this, at this time, kind of unknown, virus, they were there working and they were risking their lives because we didn't know any better if it's how dangerous, the stats weren't out as they came.
A lot of fear.
Later.
There's definitely a lot of fear around at that time.
Yeah. And, they were all there. And then what happens is when it's under so-called control and, then they cut all the staff off that either have had it or are immune to it, and then they're not working. So now the hospitals and everything is so they're lacking staff, they're lacking help. I mean, I know from many people who have rather stay at home than go in to those types of establishments because they're afraid they're not going to get the care that they should.
Yeah, and the wait lines are so long right now as well.
Exactly.
So definitely, again, my focus is actually brain health, not so much just mental health, but the whole idea that, the brain is a structure, an organ that we need to understand more. It's the only organ that we really don't do any testing on except for questionnaires that can be so subjective. And
well, tell us. Yeah,
we're definitely seeing an increase in mental health issues as well as inflammation issues, more so I think than before when it comes to the brain. Since 2020, people are just feeling discouraged, people are feeling overwhelmed, and people don't know what's going to happen next. What I feel like everyone's walking around with a when's the next shoe going to drop sort of feeling.
Right.
Like people will joke, oh, well, the kids are back in school now, but who knows how long that will last. And so there's this fear of the unknown, right? What causes anxiety is the unknown. When people have anxiety, what they want is control. That's the number one thing we need. If you're anxious, you need control. And talk about taking control away. And so I think the anxiety has really gone through the roof, and it's one of the biggest reasons.
Yeah. So you're seeing that amongst your own patients.
Amongst my own patients, on the playground, when I drop my kids off at school, talk to other parents, but absolutely among patients. Absolutely. Mm-hmm. And then so many people are working from home, and just when they got used to that, now they're being told to go back into work, but then they might not stay that way for long either. So again, it's just so many changes, and we're being told to just change on a dime so quickly.
Mm-hmm. So what is what can you tell us that most of us might not know about the brain, and also ways of testing it?
Yeah. So one of the reasons, so I've been focusing on the brain now I've been in practice 15 years, almost 10. And I started with saying mental health. So anxiety, depression, even Alzheimer's, memory. And then an infection, a streptococcal infection, caused my daughter to have massive neurological symptoms, anxiety, depression, regression in math, but we didn't know what it was. And so people were just telling me that my daughter was in the 95th percentile of anxiety, the 95th percentile of emotional dysregulation. So all of these things, and here I am thinking like, wow, here I am, I focus on mental health and I didn't even notice. And it took us months to realize that it was PANDAS, a streptococcal infection that was causing inflammation in the body and therefore affecting the brain. And people don't realize. People don't know that, sure, an infection can cause you to have brain changes. And I think this is something that when we think about any kind of infection, right now, they're calling it PANDAS, pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. But when I started doing the research, I was finding books that had been written in the 60s, the 50s, talking about how inflammation affects the brain, talking about how infection can affect the brain. So it makes absolute sense that anything we do, what you were alluding to earlier, that affects the immune system can cause neurological changes. Getting a virus, getting something against a virus, all of these things can cause changes to the brain. And we're seeing that more and more in this sort of inflammatory state. And so I think that that's a big one that people don't realize, and just how much even your diet can make a difference when it comes to brain health, because you're causing that inflammation going on in the brain. One thing that I just bought was, it's called a WAVI brain scan device. There's not very many in Canada, and it does a neurological assessment of your brain, so a functional assessment. So it's like you're wearing this cap with different electrodes that are connected to your head, and it gives you a full-on scan. And it's just been FDA, or I don't know, it is FDA approved to assess ADD and a couple of other things. And we're just going to get more and more research on that down the road as we get more people running through these different kind of programs.
I was thinking there's a brain health doctor in California. He's quite well known, and his name, of course, has just escaped me.
Dr. Amen?
That's it.
Yeah. It's because of him that I decided to get one, because I was calling the Amen clinic to say, I want this patient to get a scan. I don't believe that it's just they've got anxiety. I think that they've had a concussion. I think that there's something along the lines as well. There's more to it. But it's expensive, because not only is the scan expensive, but you have to fly there and then stay in a hotel. And so, I mean, I don't have a PET scan like he has by any means, but this is definitely a step in the right direction to be able to assess what's going on, and then use that methodology just the way Dr. Amen would, to give us an understanding of what to do as far as diet, supplements, working on certain parts of the brain that might be reacting differently based on what the scan is going to show us.
So
I'm really excited to start using it. I'm still in the process of getting trained on this one. I've been trained on this type device, but I'm really looking forward to launching that in the next couple of months.
Well, I followed his work quite a bit myself, because I've always found the brain intriguing. And, like he says, live is very different than when it's just an image that doesn't show functionality, right? So, and it's so funny, we have it for the heart, we have it for everything else, we should have it for the brain, right?
All the time I'll have patients say, like, oh, I think I should go get a CAT scan for my brain. And I'm like, well, what are you looking for? If you're looking for a tumor, absolutely go get a CAT scan for the brain. But otherwise, there's not much that a CAT scan is going to show you. It's going to show you just functionally, is everything in place. It's not going to say, oh yeah, when you're trying to do this memory work, this part of the brain's not firing. I know I had a neurofeedback scan done once on me, and it told me that I'm most likely to not have good facial recognition. And it made me feel so much better, because I'm the kind of person who will watch a movie and the main character will put on a wig and change their outfit. And I'll think, who's this new character they just introduced? So it was really validating to suddenly say, okay, this is part of the brain. My brain just works in a different way than others. And so I know now that I have to work a little bit harder, or use other identification markers than just hair color to really be able to identify.
That's interesting. Yeah, because I mean, I have a love-hate relationship with a diagnosis, right? Because sometimes a diagnosis leads you to a sort of a limiting belief about your capacity to actually heal. And because so much is based on management through chemical agents, they don't really see how wonderful the body is and how it can heal. Right. Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. Right. So I've often, been told, oh, well, this is an incurable situation. And it's like, okay, whatever. Let's see if we can make you feel better. And let's get to the root of it. And then, people get better, right? We're not allowed to say
magic.
Yeah, it's like, exactly. So
I hear what you're saying. So I actually studied German biological medicine in Germany. And the whole idea there is if the terrain of your body is healthy, you're not going to get sick.
Right.
And so I started doing chronic degenerative kind of diseases early on, because it doesn't matter how you're presenting or what the name of it is. It's, is there inflammation? How is your pH balancing? Is there dysbiosis going on in the gut? Are you eliminating properly? Is your detoxification pathways, are they open? Are they working properly? Is your methylation pathways working? And so then we don't need a diagnosis. I agree with you about diagnoses. And if we want to sort of take a tangent on that, are you finding the kids today, like, it seems like people want to label more than they used to.
Absolutely. I know, which is really, and I'm wondering if that has to do with this syndrome that we have, this free floating anxiety that feels better if it's got some label or some sort of thing, like a little bit what happened during, again, the last 2 years, where we've seen, I don't know, what's his name? Desmond, the psychologist who tried to explain how propaganda works and how, we end up putting peace to free floating anxiety once you know something, right? Even if it's kind of not necessarily true, or it's a dead end or whatever, and of course it has to be temporary. but I've had this interesting thing with diagnosis. It's like people search for it.
Yeah.
And then
it's
what?
Really interesting. And I agree with you completely. Unless you're looking to get a drug for it, why do you need the diagnosis? Why can't you just say, yeah, you know what? Sometimes I have trouble focusing and I'm kind of all over the place, but that's just who I am. And isn't that great? Because I can get a lot of things done. Do you need the ADHD diagnosis? Only really if you're getting at medication. And then we have to look at the whole reason around that. Because I agree. I actually, I had another clinic, Neurohealth and Fitness, and it was focusing on kids with neurological issues. And the owner of the company, maybe not owner, anyway, he had even sponsored a commercial, and it was and it showed all these kids, and it would say degenerate or all these bad things, right, that you could think of. And then in the end, the kid would pull off the label they were wearing, and it would just be like adventure seeker. And then the last one, for the kid that was like hyperactive and hard to focus, he pulled it off and it just said kid. Right. And it was so moving. I actually have it on my Instagram, on my Facebook somewhere. And but the thing is, I feel like today and that was maybe 9 years ago, I feel like now people are like, no, I want the anxiety label. I want the ADHD label. Yeah. It's the very fact that we have to like label ourselves, like, and my daughter's in grade 11 now, but when she was in grade 9, and right in grade 9, you have to identify your gender that you identify with. And it's like, well, what if you don't know yet? And then you don't want, right? Like, it's just, why do we have to label everything so quickly?
Right. Yeah. I mean, the gender thing, that gets me going on a whole other thing. It's like, I don't know. I just find the whole thing is a bit, we're causing problems where we don't need to on both sides.
We would have all been very confused if we had right? Because it would just be like, I'm just confused. Haven't thought about it. Like, why do I have to think about it in grade 7?
Exactly. Well, exactly. And why can't we just be who we are and everything we think about that we are? And then, eventually, if it really is a problem, who we are, we can deal with it as an adult, but not, when you ask a 4 or 7-year-old, do you identify as a girl or a boy? It's like they don't know what the hell you're talking about. It's so crazy. But there is this labeling thing, and part of it, I think, I'm just going to throw this out there, but it's that then you increase your dependence on either the medical industrial system or the government, because you either get special needs funding or you get into a bunch of drugs that, you're now, it's almost like if you can identify like this, now you're in the system.
It is true. It is true. And especially, I don't know, in all countries, but as a social country that we are in, you definitely get more. So I'm an immigrant to Canada. I was born in South Africa. My husband was a refugee. He came from Czechoslovakia. Okay. And I was filling in a form the other day, and it said, are you an immigrant? And I was going to check off yes. And I was like, but that's not what they mean by their question. So even though I am an immigrant and I have a citizenship card and I had to do the whole immigration, everything, they're not really asking about me. And I'm like, okay, that's fine. it doesn't matter, but it does give you some benefits. I do. So going back to mental health, for kids that need to get, because a lot of parents are like, when they find out their child is ADD, it's very traumatic for some parents, even though I think, wow, it means your child is a gift. Part of their brain is working so much better. But, and we'll talk about that. Is it worth getting an IEP? Because a lot of the times I'll think, well, now my child's being identified and I don't want the other children to think anything. But so many kids have IEPs now. And I will often say it's usually a benefit, because then they can get special attention, they can get special help, they can possibly get their own computer. And so because our system is built to give extra money to somebody who has been labeled in these ways, it can be beneficial in a lot of ways.
Mm-hmm.
So
right, but it's beneficial and it's sort of a trap.
And then it can kind of be a trap as well, because now you have it that you have whatever this is. And I always, especially if we talk about anxiety, I'll always say to people, no, you don't have anxiety. Anxiety comes to visit you sometimes, but let's take away this idea that this is who you are.
Exactly.
You make yourself become that. And now all of a sudden, well, I will sort of joke that, I'll have patients and the mother will come in with her daughter and that she's there because the daughter has anxiety, and she'll say, oh, but she comes across it honestly. I had anxiety. Her grandmother had anxiety. And I'm thinking in my head, and you've told her all her life she has anxiety. So now she does. Whereas I always say to people, take it out of you, put it beside you. And I get it. It comes to visit sometimes, but it's not who you are.
Yeah, I totally agree with that. Actually, I have an example of this because I was just telling you my mom just, passed away. But one of the things I will never forget, that what she did, how she stood up to the doctor at the time, that my sister, and this is public because my sister wrote a book about this, so I'm not giving any confidential information, just in case anyone's listening on that level. But she was told that because of her condition, which was Van Recklinghausen disease, it's a neurofibromatosis, that it affects mental capacity. And she was told that she could put her child into, sort of a special boarding school type thing, that she would never get past grade 1 or 2, that she would never be able to function. And my mom just threw that diagnosis out and just say, just watch me, thanks for your opinion. And it's quite moving, but, my sister went through up to grade 13 and finished it. She's running a business with her husband. None of what they said was true. And she refused to label her in any which way. She got a little extra help and things at school, but the thing is, she did not buy that this meant that,
I love it.
It's such a strong example.
One of my favorite books about autism is, it's been a while since I've read it now, but I think it was called The Spark. And again, it was the same thing, a mother who eventually just said, no, I don't believe that you're not helping my son. I'm taking him to a million things everything that the system says to do, and it's not helping. So I'm doing this myself. And she just said, I'm just going to keep working with him on myself and get through to him. And she was able to devote the time and attention. And then I think last thing and so, he was nonverbal when she wrote the book, and this was in like grade, I don't know, but grades 3, 4, something higher than that, unable to communicate. And then suddenly something woke up in him. And I think now he's a math teacher.
Wow.
Right. So,
Yeah, there you go. Yeah.
yeah. So there's absolutely something to be said for that as well. Right. Like there's so many ways, and don't just believe. So for me, if I had just believed when they told me that my daughter had anxiety, we were almost at the point where we couldn't leave the house as a family. She couldn't leave the house. It was beyond anxiety. It was beyond if you know anything about pandas. It's beyond. And so, she had dropped out of school in grade 6. They were sending us a homeschool teacher. And I would have, at that point, I don't know what I would have done. If I had gone into the system, she would be on every sort of mental health med there is. And she probably would never have left my basement again. But I just said, you know what? No, that's not what she has. She doesn't have anxiety. She has anxiety, sure. She has some anxiety, but this isn't anxiety. And I just kept pushing and pushing. And I remember when I eventually figured out it was pandas, and we were given a special doctor who had worked at us, sick kids. And I said to her, I don't care if you don't think it's pandas, because I know what it is now. And I'm just going to keep working on the neurological system and treat this as a bug. And she was, and that was it. And she was fine with it. And, we got her better. We got her better with antimicrobial.
Wow. Yeah. Incredible. But it takes such perseverance, right? To get to the root of things, not to give up and not to sell short. It's like we really have to question everything, and also trust our intuition, right? When they, especially I think mothers, they know, okay, there's something, this doesn't feel right. And just, trust that. Don't be stupid about it, but keep looking,
But I think that we are taught to not trust our intuition so much anymore. I did some research on this, and it actually it was in the 1950s when parenting magazines first started coming out. And that's when, instead of listening to our intuition and doing what we wanted, we were suddenly told, not by our moms or our family members, but by this authority, somebody who's written it in black and white, of what to do. Yeah. And so then we started second guessing ourselves. Like our grandparents didn't second guess themselves.
No,
right?
no, for sure.
For us. And yet now we come from a society where we're so self-conscious about what to do and, what to expect when you're expecting. And
right. Yeah.
I will tell people, don't even read that. Like know a little bit, but just use your intuition.
Yeah.
Use your intuition, do what feels right.
Exactly. Really connect.
Connect,
yeah. Anyway, our time is like up. So do you have any last statement for everyone?
Yeah, absolutely. I would love it if your followers would follow me. I have an Instagram account. My handle is at Dr Debbie Smrz, so at DrDebbieSmrz. Sorry about that. I also or check out my website, natliving.ca. And I would love to hear from anybody if they've got any questions.
Okay, well, thank you so much for sharing your knowledge and the possibilities. I just find that we need to know that there are options and that we can, trust ourselves and keep open. So thank you for the positive message.
Thank you so much. Thank you for having me.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.